Help is always important. Um,
And we'll pick this up. We'll give another minute, but to the Health Partners IS&T colleagues, Lynn just sent out an email as well. You know, we're just in business evaluation on this initiative. So this might not be the best use of your time. Uh, just knowing what we have on everybody's plates for year-end tasks. So feel free to drop because like I said, this is in business evaluation yet.
that's what the trick. So,
All right, Lori, do you think we're good?
Yeah, I think we should probably get started.
okay. Well, terrific. Thanks, everyone. And we are
Michelle, maybe I'll just do a little intro before we and
terrific.
introduce you. Um, so welcome everybody. Michelle, for your information, we have many of the leaders from our claims operations and administrative operations development team um, participating today to get an overview of a COB uh, initiative that Lori and I attended a symposium at the end of September. And we have invited Michelle Toscano to give us an overview of this. As we know, COB is a very important stewardship initiative for Health Partners, not only for us, but also for many of our self-insured employers as well. But it can also be a frustrating process for us and for our members and for our providers in, inquiring to members if they have COB, if they don't return the information, we'll close a claim for receipt of that. And we also don't pursue first dollar on COB if we don't have the information. So this process looks more at eligibility and shares information across many health plans across the United States. And so Michelle has offered to come and give an overview to all of us as we evaluate this for Health Partners participation and use in the future. And with that, Michelle, I'll kick it off to you.
Thank you. Again, we are thrilled to have Health Partners, the opportunity to present COB Smart to you all. I'm just going to go over a little bit about who CAQH is, what we're solving for with COB Smart, and then we'll kind of get in the nuts and bolts, if that makes sense. So just a high level around CAQH, we're a nonprofit. We actually launched in 2000. We're the folks that writes the business rules around HIPAA X12 transactions. So if you hear of CAQH Core, again, we wrote the business rules around the 270 eligibility inquiries and responses. That work continues today. We do things like trying to find a standard data set, a standard data process for things like prior authorizations, documents, things like that. So we work with our board, which is a group of health plans, to try to find these business processes where, again, if we could standardize a data set and a data process, we could drive these efficiencies across the industry. So basically, when we look at COB, we found it's an extremely cumbersome, expensive process because plans do not have the eligibility information that they need when that member goes for health services. So again, all the downstream COB issues, I'm not going to go through them. But again, we understood that if we could deliver good data, frequent, high quality, validated data to health plans before the patient goes for access, we could really cost avoid all COB downstream spend. So what did we do? We, with our board of health plans, created a database, and that's really what COB Smart is. It's a database of all lines of business for commercial plans. We are primarily commercial group. It's your ASOs, large groups, small groups. We have a good size portion of the managed Medicaid plans on our solution today. We take in, Medicare Advantage, and then all of the ancillary. We do FEP for the Blues FEP program, including other folks that have business on there. I'm sorry. Okay. So again, it's a database of all lines of business today. And certainly as Lori and Cindy, saw from our symposium, we have over 225 million members on the database today. And we are thrilled in over the last 2 years, we've added about 30 million members. We launched COB Smart in 2013. In 2020, we enhanced it with data validation so we could deliver a 99.5% accurate overlap, and that has just fueled the whole solution. So we are thrilled, kind of about the success around that. So again, we're this database. And we have health plans all across the country. We capture COB from all states and territories. So these health plans send us their membership information every week, right? And so we take this data, we match it nationally across the country. So you're going to get a lot more COB with a national matching solution versus this kind of data mining thing you're doing now. And then we support, and then we send back really actionable information, but then we also back all the data up on a portal. So think about your members sending us a file every week, and we'll get into the nuts and bolts on data exchange. Every Monday morning, they get net new COB overlaps 52 times a year. They go to their portal and they are looking at an overlap, and they are looking at a side-by-side view of that member. So if you were Aetna, you would see all the member, information that you sent on that member. You would see the other side of the overlap, Anthem, who has also that information. You would see the date it was validated. You would see a primacy determination, and you would see all the codes on why we found it that way. So we're going to get into the details, but what we have within COB Smart is a continual data loop. Right now, it's about 57 health plans and over 220 million members of collecting data every week, matching it, validating it, and resolving it over a portal, if you will. Any questions? This is a high-level premise, but we're going to get into the details. Here's a good summary of how it works. Today, health plans submit a standard file. It's 65 fields pulled from your claim system or your source of truth. And this is member demographic and coverage information. So we send your file as well as every other, the other 57 health plans. You guys send us this file PGP encrypted. So it's, it's secure at rest and in transit. You send it to an SFTP site that we set up for you. You drop it off by Tuesday of every week. We match it. We determine primacy based on NAIC rules. We do not go down to the state level, but we give you a primacy recommendation. And then as soon as that overlap is identified and we find primacy, we automatically send a 270 inquiry, not only to your health system to say, hey, Michelle Toscano, is she still active in your system? Has she termed? But also the other health plan, so you know that that member is active in both systems. And we deliver that back to you with a 99.5% accuracy rate. The primacy determination is a recommendation based on NAIC rules. The accuracy that it is an active overlap is at a 99.5% accuracy rate. So we send this back to you on a weekly file via SFTP. This, and again, it's updated on the portal. To be clear, COB Smart does not integrate with your systems. We are a data service. You drop off a file, you pick up our file of overlaps. Any questions about that?
Michelle, this is Lynn Weiss, and I just, I probably should know the answer, but is this for medical and dental, medical only?
Medical, all lines of business. Today, we deliver back to you a medical to medical overlap that's validated. We will also deliver back to you like a medical to ancillary, and that's that medical to dental, medical to behavioral health. We also deliver back to you a pharmacy to pharmacy overlap. That is not validated yet. We have to build that business. But again, that's part of the solution. We have, we see 10% overlaps around pharmacy. It is a kind of a new concept to a lot of folks. But again, that's what we're delivering back to you today. So this is for all lines of business. Again, we have, I think I sent out earlier the client list of where we are today and the scope of that. I also sent you out a fact sheet. So, any other questions before I move on? Okay.
Michelle, this is Cindy. I think what I recall is we can decide on the ancillary services like pharmacy, dental, vision, which ones we would want to participate in.
You have, again, we basically aggregate the data and then match it and send it back. You have complete control over, what you send to the database. You really do. The only thing that we really fight back on is if you're going to say commit, 100,000 members to the database, we need consistency for you to keep them on. We don't want people taking members on and off. These overlaps that we find are a matter of record and audit. On the portal, you have a 3-year view of that member's COB history, and we'll get some of those details. So obviously, there's consistency there. And again, so not only are we delivering you a really high quality overlap, we're delivering you consensus on a portal. So we're replacing COB collection, we're replacing primacy determination, we're replacing validation, and then we are, again, I'm saying replacing, we're automating it, we're replacing manual processes, but we're also giving you a secure portal for you to exchange this data with other health plans. So this waiting on the phone, leaving messages and things like that, again, that's all changes. So what we give back to you guys is basically 3. Okay, so we have really 4 categories. I'm not going to get too much into the weeds because we do have, there's a lot to present here, but basically we give you back 4 categories of COB. And so here is your O4s. That would be your pharmacy or pharmacy to pharmacy overlaps, or your medical to behavioral health. We have the O2s, which are folks that are not subject to COB, typically your students. Then we have the O3s. This is where we found a medical to medical overlap, but we couldn't determine primacy. Sometimes there's a court case. Sometimes there is 3 coverages. We tell you why. And again, that's something that you would want to queue up as something you want to research. But again, where we used to, before data validation, where we used to send you back a lot of data that you had to navigate. Now we're sending you back this data with an accuracy rate on is that member active. So again, we really have filtered this out so you can focus on the most important data to really see you get your benefits. Then we have the O4s. These are the medical to medical overlaps that are validated with a primacy determination. This is where our plans today are auto-loading these directly into their system without manual review. We don't recommend starting this way, but we want you to get a good, sense of the data. So think about when you guys, get overlaps back. And again, we're going to find a lot more COB than you're finding today. A steady state on a weekly basis is about 10%. So if you guys have, 100,000, million members or 900,000 members, you're 10%, you're getting net new COB overlaps, roughly 10% of your population every week. So it's really important, to be able to filter this data. And then we're taking those medical overlaps and immediately, again, it's the week that as soon as they're identified that week, getting the validation. So this is a continual loop of COB identification and validation. So the quality of this data, again, just blew off the, we really changed the game with validation, but also being able to work COB with another health plan in a portal. You're going to create a data relationship with the folks that you see the most overlaps with. And I hope, Lori and Cindy can attest to kind of the data community, that we have. Any questions about validation? To be clear, so COP Smart is our vendor is Experian Health. They host our system. Our entire solution is member demographic and coverage information. This is all PHI. This is all stateside in Franklin, Tennessee. Experian is, will be the folks to set up the SFTP site. Experian is also the clearinghouse that's going to check your claim system via EDI for these X12 eligibility transactions. We don't integrate with your systems, but Experian would call your EDI contact and set up a COB Smart NPI number so we can get those transactions just like your providers do today with the clearinghouse. So there's no IT around that. It's just, authenticating that NPI and doing that. Any questions? Okay. So we give this data back to you. Again, you guys send us this file by Tuesday. We send it back to you by Monday morning Eastern time. So your folks have new information to work. The web portal, and again, is a meeting unto itself. But this gives you, web. It's typically, think of the web portal as for one-offs. If you can be able to sort your data from COB Smart, saying where are my high claimants, you can start with member searches. And again, there's multiple functionality in how to do that. You can override data. You can send an inquiry out to another health plan and say, you know what? We just heard from our member. We think you need to override, data. We have this determination. You're able to see. You have dashboards within the portal to say, okay, group migrations. You're starting to see United. We're starting to see on the portal or the data in COB Smart that United is terminating a health plan. We're starting to see that you guys are enrolling them. We have things like group migrations. You can, for each individual records, you can upload documents, to really provide evidence to another health plan that your member is in fact secondary or things like that. You can do note fields. Pair-to-pair inquiries on the portal has also changed the game. Again, being able to go back and forth with these folks. You have dashboards. You have 5 to 30 days to that you can ask people to respond. There are no SLAs around this. Everybody, we have one service for COB Smart. This is a low-cost utility. Everybody gets the same service, but every month, our clients work with an account manager. They go through your dashboard, and we'll get down to that to show you how many inquiries you have, how many group migrations, how many members on the system, what your COB rate is. We only focus on COB. We do not do recovery. COBs, like I say, we provide data for you to cost avoid. COB by getting these COB updates updated to your claim system so you can deny a claim, or you can, again, pay primary and auto adjudicate that claim. Question from anybody?
Yeah, I just have two quick questions if you don't mind. The first I failed to ask, in the file exchange where we're sending eligibility, are you looking for the delta? Or, what I mean is this a full file replacement every week, or are you looking for our ads, changes in terms?
We want your full membership every week, including, and so you would send that including any ads, terms, or deletes. So again, the idea is always full membership. Yeah.
Okay. And then as a part of this, how do I want to ask this? Do you have anything, any vision for the future where providers may tap into this Experian database to determine whether or not a member has multiple insurance carriers? Any thoughts there?
It's a good question, and we have a CAQH is uniquely positioned, and I'll make this very short. We also, and I know HealthPartners, you guys, we have no footprint with you guys, as a company, but we also have, over, I think it's over almost 2 million providers in a database. Our thought for the future, and again, if I told you more, I'd have to kill all you guys on the call. But again, we are in a very unique position to have the largest member database in the country and the largest provider database. So we look to the future, and we could put all those data use rights over to the side and really provide data as a service, to perhaps populate or compare an 837 or an 834. Again, because we are building, we've gotten such huge momentum. We have a lot of use cases going forward. So I'll kind of leave it there without getting too far ahead. Okay.
That's great. I'm
Yeah.
sure you know that we're not only a health plan, we have a large care delivery system. So just curious as to down the road, might we as a care system be able to help utilize a solution like this to determine if somebody has multiple insurance companies?
Today, and we get a lot of providers that call us, a lot of provider groups, a lot of, ask where can I get COB data? I don't know how to pay a claim. And so basically what happens is when you guys are processing COB Smart and those X12 transactions update the database, if a provider is using, and we have three contracts with, I think, Experian, TransUnion, and Health Nautica, they can use those clearinghouses to get COB data. CAQH is a nonprofit. We never charge our clients or our providers for data, but if the clearinghouse will charge them for that transaction, but we don't charge them for the data.
Okay.
Okay. So, but it can be shared. But we do not, I have to sell what's on the truck today. So that we don't do that today. Okay.
Fair enough.
Okay, so the idea here around COB Smart is a prospective solution. We want to get in front of COB. So the idea here is you're going to get your COB Smart's response file every Monday morning. You are going to, you send us a file, we send you back these overlaps. HealthPartners has to build a database, and whether that's, we usually recommend SQL with a plan of your size, to consume this pipe, and we'll look at the file formats and all that stuff, but you're going to consume these overlaps based on not only the COB Smart outcomes, but your health plans, your business folks, their business rules. So when we say internal business rules, are you going to sort this by highest claimant? Are you going to say, however you're going to sort this and how that's going to be distributed? The idea here is this data will go back, and that the validated, 04s, as we call them, those validated medical overlaps. At some point, we want to see you start overloading, auto-loading, 20, 30% of those overlaps that are coming in. So you have the most frequent COB data in which to build, which to pay claims more accurately. The other part here is this manual investigation. Again, you have super highly accurate data, not only from you, from the other health plan, you have communication. Not on the portal, you can send inquiries automatically between health plans. Every health plan is also required to have a contact name, for that reporting entity, and a preference in how they want to be contacted. So you're going to have, that kind of capability. The idea is that even for, if we're not able to find a primacy determination for some reason, you have the data and the priority that you need. If you know that overlap is active, it's validated as active, then you know that it's worthwhile researching. So hugely important. The idea here is set the COB flag, and certainly your net new secondary, again, is super highly accurate data and an immediate source of savings. But also, even if you find out that you are primary, again, you're not pending for suspected COB. It basically is super highly accurate, frequent data that you're fueling your whole system with. And we look at this is that while you can recover COB and things like that. And, we look at that as 60% on the dollar. But if you're getting in front of it in its perspective, you're saving, 100% of that medical spend dollar. Okay. So I'm not going to go into too much of the portal features, but I just want you guys just to be clear. I didn't know if Cindy or Lori, should I kind of go into the business case around HealthPartners, or I'm going to kind of stick with the solution? Because the business case, the business case is, basically based on your market penetration. We basically, with all the plans that we have, we can show you views of Minnesota, and in the number of health plans that are already in the system, and kind of who you would interact with. Does that make sense to you guys? Well, let me just go to it. Okay,
so
go
I
ahead.
I think the business case does, at a high level, we've shared with a few people that, if we were to join CAQH for COB, the major carrier that isn't in the mix is Medica. But why don't you proceed with that?
Okay. Okay. So let me just go over here. Okay. So hold on. So basically, when we're thinking about HealthPartners, again, we think of your service area, Minnesota, but we know you guys are actually also in other states. So basically in Minnesota, the top 11 payers, and again, you have to know that there's a whole tail end of these payers, but certainly Blue Cross and Blue Shield of Minnesota. Yes, I'm looking at someone's, yes, COB Smart includes, commercial, Medicaid, managed Medicaid, Medicare Advantage, all lines of business. And if you look at our client list, you'll see the large Medicare Advantage folks out there like Humana on our system. There's few folks that we don't have on our system today. So we look at Minnesota. We see Blue Cross Blue Shield of Minnesota, Anthem, United, Aetna, Cigna, HCSC, which is these 5 blue plans, the Blue Cross Blue Shield FEP program, Humana, Highmark, every. Again, we have more folks coming on the system at all time. When we look at Iowa, and forgive me, I know this is really low. They send it to me in a picture. I couldn't increase it. But again, you're going to see Anthem, Centene, United. These are the folks that you're going to start creating a data relationship with. You have portal rights. And to be clear, when we talk about the COB Smart Portal, this is an enterprise solution. We don't charge you by the number of members on the portal. So you guys give us a contact for the administrator. That administrator has all rights, and they can assign privileges, read write only, group migrations, data overrides and things like that. And also, to be clear, you own the data we give you. You can, receive that file in every Monday morning and send it right out to a vendor. You can assign a vendor access to the portal to look up members. We have found over the years that there is the control you have getting this data in and being able to cherry pick your best opportunities based on your business rules. It is really how people go. We'd rather see you cherry pick your best opportunities. And then, we see folks giving second, third, fourth passes. Again, so you have complete control over that. So that's, we see a lot of folks, again, the idea is you want to be prospective and find COB, before it happens. Also, to be clear, we talk about COB Smart as a shared data solution. Because again, everybody's on the portal and things like that. You only share data with members that you have an overlap with. This is confined to that. This isn't like everybody sees everybody's data and things. So we're good there. The folks that we don't have in Minnesota today are right here. Certainly HealthPartners, Medica, UCare, Preferred One, and Prime West. These are our targets from, I'm part of the business development team. I will tell you that right now we have about a little over 53% of the folks in Minnesota. If Health Partners were to get on board, we would have closer to 74%. So the idea that you're centralizing COB digitally, and again, and you are replacing all of these functions like collection and validation with automation is a significant lift. Any questions about that? What I did want to talk about is fees. And so the beauty of COB Smart also, like I say, we are a data utility designed for national adoption. We are a low-cost utility. So for folks like HealthPartners, we look at your one-time implementation fees between 11 and 20, 11.5 and 25. This is a one-time implementation fee for, we say 4 to 5 months of implementation. But to be perfectly honest with you, we need you guys to have a really good file, because as an example, if HealthPartners goes live with 900,000 members and it's bad data, you're going to significantly impact Blue Cross Blue Shield of Minnesota. So we work with you to get you business ready, not only to submit a very good file, but also to be able to consume it, to work it, to know how to add, change, and delete members and things like that. We also have a one-time, and I'll say one-time EDI fee. So to connect that NPI, that Experian Health NPI number to your EDI folks. Now you can talk to your ED folks. We charge $3,000 per testing path. It's pretty much at cost. COB Smart, again, it's not about, we're not making money on implementation fees and EDI fees. We want you to go live. But when you think about our per member per year fees, it's 28 cents per member per year to manage your members on here. I don't know what you're paying for letters, but I can tell you we're probably under the price of a stamp to be able to manage your members this way. So when I looked at, again, based on 900,000 members, your first year for setup costs, and that includes a one-time implementation fee. And I think I put $20,500. That's like maybe one extra zero there, I realize. But that's what, meaning even after you go live and you decide to bring on another line of business, you buy another company, we don't charge you again. That's it. So we know you think you know how to build a file and test it through, and you work through that with your account manager, who's going to work with you on a weekly basis, once you're up and running. If you happen to purchase another company or go to another claim system, we will have to connect you via EDI. So that again, though, and we would only have to do that if, again, you have new members coming on board and we don't have that EDI connection. So again, we are it's truly a low cost utility, and our contracts are standard, and they're roughly 2 years with an auto renew. I'm not going to get too deep in the weeds there, but just to be clear about what COB Smart is that we were designed as a national data utility and really trying to become the one source of truth for COB. So, but we're a national solution, a prospective solution, and then we're scalable. Again, we have United and Aetna and Cigna. But we also have folks like, Southern California pipe fitters, with 20,000 members or a union Taft-Hartley plan. The idea around CAQH and what our mission has always been is to automate redundant, costly, and cumbersome business processes like COB so we could reduce medical spend. And that's exactly what we're doing here with COB Smart. High quality, again, now that we've added, and we can go through the data quality model, if you guys are interested in, in getting to the weeds there. But again, the idea here is not only the highest value and highest quality overlap, but the most frequent. Again, shared data model, we covered that, the portal, but we are a long-term data strategy. We are not going anywhere. We continue to build, and you're not going to have to replace this data. You're never, COB Smart is always going to be a fluid, and it's going to continue to improve as more members get on the system, and more plans adopt. Hopefully, what we learned, what Lori and Cindy learned at the symposium is that our members benefit, our clients benefit when more plans use the system. Again, it helps them centralize, They don't have to do things out of the, out away from COB Smart manually, collect claims data, data mining. They can get data right from the source, right from the health plans. And it really, again, it really gets them out in front of the whole COB equation. Any questions about that? Oh, I'm sorry. I meant to say something about references. Blue Cross Blue Shield of Massachusetts has been asking to talk to you guys for a very long time. Again, they understand that if you guys are in the system, it's going to streamline, all this COB process for them. And they know that they're going to see more COB opportunities, as will you. So we are happy to connect you, not only to personally to Minnesota, but you can talk to other commercial plans, folks like Medical Mutual of Ohio, who have a similar, lines of business as you do, and things like that. So we're all about that. The problem with COB Smart, you really can't test our production data until you go live. So we do POCs for folks, but they're limited. So basically, in just really high level, we would ask for maybe 300 members per lines of business. We would have to sign a BAA first. We would have to sign an SOW on how this would work. So there's work on this, but basically you would give us the data via secure email on maybe 16 data elements per member. So it's much more limited than the 65 fields will require, but we can knock it against our environment where we do have all plans loaded. It's basically our sandbox, and then send you back the data. And what we'll prove is we can find a lot more COB, and we believe that what we can send you back is more accurate than you have today. But to be clear, the BAA has to be signed. We have to sign, structure on how that would work. You guys only have to build a file for 16 fields, but we give you back the COB, and you have to, manually identify, go through this to get metrics on it. So the lift, we can turn it in a few days. So just say that's out there, always for you guys, but again, it's not validated data. It is a snapshot in time. It's not like getting 52, cycles of COB data, but it's the closest we can come to be able to giving you guys some hard metrics. Any questions on that? Okay, I have one. So I'd like to get, I'd like to kind of get a little bit into review. Okay, so I keep opening the, okay. So that's what I did want to just give you guys a little bit of an idea. Can you see my screen still, or I stopped sharing? Okay. So
We lost you.
okay, thank you. Am I back?
Yep.
Yeah.
Okay, I just want to give you guys a little bit because it's very important. So COB Smart today. So we have certainly you can contract directly with CAQH and take this internally. We do work with 3 TPAs today who actually are contracted with us. So if you were interested in processing claims with Evolent, Web TPA, or folks like SkyGen, again, that's a way to access COB Smart also, so you don't have to, build out these systems. We also have a really good partnership with folks like Performant, which is a recovery vendor, which you can outsource the whole thing. So what I like to do with folks is make sure have a good sense of what the internal effort is to bring on COB Smart, so you can look at those comparisons. There's a lot. We're going to totally change your legacy process. So there's a lot to consider here. So let's just to be clear, and I'm not going to get too deep in the woods here, is that basically you would be submitting membership, and you can break down your membership however you want. So you could break it down into lines of business. You could break it down by state. Here's an example. How about Aetna sends us what we call reporting entities. The whole company is Aetna, but they have multiple reporting entities. Each one of these reporting entities, again, you're going to be able to connect with that person. So that's how you would kind of break down your data. when you're building your file, maybe I got a little bit ahead of myself. So just to be clear about implementation, and I'm sorry if I'm stepping back a bit, but it's roughly 4 to 5 months. So you would be testing, building this 65 field file. You would have multiple testing cycles. You have to pass compliance and conformance, get good outcomes. At the end, we connect you EDI, and then once your data's on the portal, in the system, we could train you on the portal. But basically, you would need what we recommend for this. You would want a project manager. You would want a business analyst. We don't want you to start automating the data until you really have a very good sense of how it impacts your information. We want EDI users. We want contacts. We want portal users. We need the business leads to tell us how you want the data filtered, and we want the technical support folks to build the file and then understand how you wanted to consume it back. You're smiling. Is that I say? But I get passionate about this. I actually was with Trizetto and came to CAQH after seeing this Capital Blue Cross present on this. But to be clear,
No, it was just a funny side conversation. Sorry, Michelle.
Okay. So basically with COB Smart, you guys would be building 65 fields, submitting this to the SFTP site every week. You would get back your data, all the other health plans data, and in all that information on that member. You would be getting the primacy determinations, the classifications, the coverage dates, and then you're getting back this validation status, right? So these are going to tell you the priority of that overlap. What's the overall validation status, active or inactive? Was it active in your plan or inactive? If you know that we validated an overlap and it comes back to you and it says it's inactive in HealthPartners claim system, you can go to the portal and delete that member, stop paying for them. Again, it's a lot of solutions are based on per member per year. Make no mistake about it. COB Smart is going to deduplicate your membership. If you have issues with your membership data, we're going to find them. We have found them. That can delay sometimes implementation. We found out that a health plan had provided, a big health plan actually, had provided a PIN number to all their members, but for some reason, there was only one PIN number for twins. And so they had to manually go back and fix all this data. But we're going to find it. We hope we'll all be better for it. Anyway, so this is kind of the data that comes back to you guys. You're building a pipe delimited text file. The idea here is it's the most malleable data that we have. And again, because every health plan has a different format, this is what we use. I'm not going to get too into the mandatory, required, and optional fields around this. This is typically really covered in detail with implementation. Once you guys get to a point of evaluation, we would need to sign an NDA. Then we're happy to send you specs so you guys could get an estimate of what you think it will cost you to build this file. And then, so again, just kind of looking at this submission area, you guys would be submitting this either between areas between Sunday and Tuesday. We send it back to you by Monday of each week. All right, I'm not going to get too detailed on some of this, but it's very important for you guys to understand. Hold on, let me get down here. Is that when you're getting this data back, and we talk about it being actionable, these are your validation statuses. And this is kind of what I wanted to hover on a little bit, because you're getting this back, and anything in field, like as you're getting this back and you're thinking about how to distribute it, anything with an active validation status can be auto-loaded. And again, we want you to look at it and things like that. You're able to see whether they're active in both plans or inactive. If there was a data error, something happened within that EDI transaction, or perhaps if the payer's down. For your EDI team, we do this off hours. This isn't going to affect the flow that you have in now. The beauty here, not to get too far ahead, is that if your field 96 comes in as active, you're going to be able to automate fields 58 and 75 if you get these back, because you should be getting updates on your validation statuses. So this is where, there's a continual data loop of plans updating, going back in, seeing this data, updating this information, and really making it the best data out there. So just thinking about benchmarks and ROI, we want you guys to think about COB Smart is being able to understand the number of validated overlaps that you're going to get back, being able to, one, either not review them at all and auto load them, but really think about your cost avoidance opportunities when you're primary or secondary. I'm sorry, when you're secondary, so you don't have to pay those claims. The number of overlaps that you're going to get back and that you don't have to review. Your staffing will shift. We would rather see your analysts spend times on net new secondary COB and resolving COB with other health plans than waiting on the phone, trying to get this information. So that's really the premise around COB Smart. I don't want to get too much into the weeds. I do want to let you know, in addition to COB Smart and the functionality that you see here, we also provide folks a tool around retrospective validation. So when you go live, we take all your active members. You can also give us historical data, and we do this for free for you because we only charge you by active members. So you could retroactively validate overlaps. So this is a tool for you. People use this especially during open enrollment. Again, it's an ad hoc service. If you wanted to do it, you could do it by payer or timeline. And then again, we have the pharmacy solution now built in, giving you pharmacy to pharmacy overlaps. Just the last thing I just want to show you, this is a good look, is that once you go live, COB Smart is incredibly transparent. We only focus on giving you the right data at the right time so you guys can pay correctly. We don't do any recovery. This is a good idea of the dashboard that you would see every month. So you would see the number of members on the system. We would break it down by lines of business. We would show you the number of determined, undetermined primary or secondary, what your COB rate is. I don't know what your COB rate is today, the percentage of overlaps that you find based on your total membership. Like I say, we're up around 10 to 11% on most members. And then you're going to see how that breaks down. So there's all kinds of transparency here. We only can charge you, once you go live, we can only charge you per member per year. There's no other pass-through fees. So we have predictable fees for you guys to budget and for years and years to come. Any questions? I know that's a whole lot in a short period of time. We're very excited for you guys to evaluate this. If you talk to other vendors, while you can send them our COB file, no one has the data that we have because we are the only folks that have BAAs to aggregate and collect this across the country. We're really trying to break down these eligibility silos and really have this one data source for everyone. So whenever you guys, kind of next steps on evaluation, we'd love for you guys to talk to some of our references. We are going to be going forward with webinars, probably in January and February for, folks like, so our Anthem, we have a Sherry, and she actually has COB Richardson in her email. She's with Anthem. Again, they're a member plan. They helped launch this solution. She's been doing COB for 35 years, and she's really been very integral. The COB Smart work group is part of our member plans. She might start doing things like burning COB questions. It really improves, COB Smart lifts all boats. The better the data, the better it is for everyone. She might start doing things like burning COB questions for folks. We also have within the portal analytics, so you can track all your members on the system. We also have a forum. So things like new legislation in Minnesota, it is very interesting, not only to you, but all the other, plans that have members in Minnesota. Those things are covered actually and are able to look at in the blog. It really is a data community for COB. So I'll stop there. I know this is an awful lot. I can follow up with a short subset of the deck. And we'd love to kind of go take next steps and have you guys talk to our plans. Again, we would give you their contact information for you to set up on a plan-to-plan basis, so you can ask the questions you're interested in.
Yep. Michelle, I see Lynn has a question.
Okay.
I do. I have like three, and I hope they're pretty quick and simple. The first is when you talk about, that 270, 271 process, just for understanding what this may mean from an internal purpose. Are you sending those to validate the overlaps? Are you sending that one by one in a real-time transaction, or is that a batch file that you're submitting with?
As soon as it's automatic, as soon as the overlap is identified. So okay, yeah, so it's immediate that happens.
So it's a real-time transaction, not a batch.
It's real time, and actually the beauty of this is that it's updated on the portal real time. So even though we have a weekly file, your validation status is real time on the portal, so it can be up to 10 days. So that's, like I said, that is a huge. Again, it's certainly it's a high level of quality, but it's consensus, between plans. Okay, next question.
And then I was just gonna say, if I understand it right, again, just for internal assessment, what we could do is take our volume of our members, that we would be putting into this solution, high end times it by 15 to 20%, and that would be the volume of additional transactions that we may expect. I know you said 10 to 11%, but we could up that and just, okay. And then, when you have a new plan coming on, do you have a recommendation as to how far back does a plan go historically to look for this information?
No more than 3 years, because I think there's also limitations on COB around that. It's your options. When you go, the historical data is one time. We give that to you at go live. You're going to get a lot of data back. And I know that, we always tell folks that we really work with you, have a strategy around go live. But again, it's up to you. It could be 6 months, 18 months, but no more than 3 years. And honestly, you really wouldn't want more than that. But that's kind of a perk that you get this data back. And again, you have, you can work with any way you want to. Yeah.
Okay.
I'm just recognizing time, and I want to thank Michelle. She'll send the slides to Lori, and then we'll work on distribution as appropriate. For everybody that's participating, if you have feedback, if you want to funnel that through to Lori and I at this time, and then we'll have some follow-up discussion on, next steps with the leadership team that's around our cost containment and cost initiatives for claims cost management initiatives team. So I really want to thank everybody for participating today. I hope this built some understanding, and thank you, Michelle, for sharing all these slides. And the conversation, it was very helpful, I think.
Thank you. Have a wonderful day.
Thank you.
Bye, everybody.
Bye.